Go, go. Yes. Thank you.
And now it is my absolute pleasure to welcome Xavi to the stage. And I would love for you to introduce yourself to the audience, please.
Okay. So I'm Dr. Shabnam. I am the woman health strategist and medical advisor. My focus is on perimenopause transition and menopause and how to basically navigate this recalibrating phase of life. That's what I do.
Thank you so much, and it's wonderful to have this conversation with you. So, as an introduction, women's longevity medicine has traditionally focused on hormones, metabolism, and cardiovascular risk. However, emerging evidence suggests that another biological network may play a fundamental role in determining resilience, inflammation control, brain health, and healthy aging: the endocannabinoid system. Today, Dr. Xavi will challenge some of our current assumptions about female aging and introduce a provocative new concept: endocannabinoid aging. So, Xavi, your presentation introduces a concept that challenges traditional models of female aging. Are we currently underestimating the biological importance of the endocannabinoid system in women's longevity?
Yes, so before the answer to that question is a definitive yes, but before we get there, I just want to shortly explain what the endocannabinoid system is.
Grazie.
Because most of the conversation around perimenopause, menopause, and woman aging start and ends with hormones. Hormones, if we are lucky, but most of the time estrogen, which is true, which is like, you know, as a woman, you are born with a very limited reserve of eggs, and during your life, the amount of eggs reduce, and it drastically reduces between like mid-30s up until the time that your ovaries do not have enough supply. And these ovaries, these like small eggs, are a woman estrogen factory. So that's what happened, is that when the brain, and that's the first very little woman knows that's the first organ actually to really understand the decrease of estrogen is our brain. So that's why many women, like end of 30, they start to think, okay, I'm not feeling like myself. Brain fog starts, you get fatigue, you get like, your skin get dry. And I always say, it's a huge, like we women sometimes do some unfavorable stuff to us. For example, we always think menopause is equal to be an old woman. It's far from true. That's a misconception that really destroy our mental health when it comes to perimenopause transition. Because first of all, we don't have like something like menopause that from this day after that you are menopause. It's like complete BS. Perimenopause transition is a recalibration transition which starts mid-30. When as a woman, it starts mid-30. Gradually, the number of eggs reduce till a point of time that you don't have any period because the eggs is over. And here is exactly the point that endocannabinoid system comes in. As I just said, estrogen is a hormone it's omnipresent. The receptors in brain, liver, skin, everywhere we have estrogen receptors. And when it declines, we have all of these basically symptoms and the endocannabinoid system. And if there is one thing that you're gonna take with you out of this talk is please just search, just Google what is endocannabinoid system, because your doctor might not even know it. Is a master regulatory system in the body. It has been discovered like 35 years ago. And again, it's as omnipresent as estrogen. It modulates sleep, appetite, immune system, reproductive health in women, and everything that you name it, endocannabinoid system regulated. And estrogen has a direct interaction with that system. So of course, when estrogen, and that's again another misconception, we think throughout the perimenopause years, the estrogen is declining. Yes, it's declining, but not like that. The estrogen decline like this, because these 6 to 8 years, for some women 10 years, is like the years that this week you might not feel like the next week. This week something is working for you, the next week might not, because all of these up and downs of estrogen. And that plays an important role. Like when we talk about longevity, I always say longevity is a fancy or trendy word for prevention. Longevity is prevention. And we cannot talk about longevity without naming the endocannabinoid system.
Thank you so much
Sure.
for bringing up this incredibly important topic. For decades, menopause has been interpreted primarily as a consequence of declining estrogen
Yes.
levels. Is it possible that part of what we attribute to hormonal aging may actually reflect progressive dysfunction of that exact system?
Yes, because of that, I gave that introduction. As I just mentioned, estrogen and endocannabinoid system work hand in hand. Like that estrogen regulate or modulate many other processes in woman body. For example, like what is related to the skin and the beauty from outside is the kind of the amount of mucus or the amount of water that your body produces. So when you go through the menopause, because of declining estrogen, because of this regulation in the endocannabinoid system, you generally produce less water. You get dry eye, you get dry mouth, and you get dry vagina. That's like completely normal. It's something I always say, women should talk about this more often and talk about it loud. It's nothing to be ashamed of. It's not a indicator that you are less interested to be close to your partner, or you don't want to have like intimate moment. No, it's something biologically is happen, goes hand in hand with estrogen decline, goes hand in hand with the endocannabinoid system dysfunction. And the endocannabinoid dysfunction, one of the primary outcomes is you get more sensitive to pain. And when we talk about, like, again, healthy aging, when we talk about longevity, pain is one of the, like, we tend to spend a lot of money on, beauty products, but we really don't think about, so sometimes we think, okay, the pain is normal, I should tolerate the pain. No, pain is almost always a signal that something is like disbalance in your body.
Bitteschön. Beautiful. Your work suggests that the endocannabinoid system acts as a master regulator of stress adaptation, emotional resilience, inflammation, and brain function as well.
Yes.
Should we begin to view this system as a central longevity network rather than a secondary signaling system?
It is a longevity network. Again, like, we cannot talk about healthy aging, we cannot talk about prevention without talking about endocannabinoid system. And I just go one, like you talked about brain fog, Alzheimer, all of these stuff that happen during this perimenopause year. And by the way, when we only look at the numbers, when we talk about anxiety, the prevalence of anxiety for women is 2 times more than men. Alzheimer, 2 times more than that. Fibromyalgia is almost a woman health issue. 8 out of 10 patients are women. And again, all of that is interconnected with the endocannabinoid system. And yesterday we talked about GPL, these insulin medications for weight management. Endocannabinoid system is a huge regulator of our body. Actually, endocannabinoid system regulate all of these satiety signals. So if you don't have it at the balance, if you cannot address your endocannabinoid system with healthy and preventive measures, then it doesn't matter how much you try to fix it from outside, you have to fix it from outside and inside. That's all what I'm saying. Yes.
So one of the most fascinating ideas in your expertise is the concept of endocannabinoid age. So could biological aging be occurring at different rates within different physiological systems?
Yes.
And could ECS decline represent a measurable dimension of aging itself?
Yes. So we know that like by each decade of our life, the functionality and the signaling of cannabinoid receptor, especially CB1 in the brain, reduce. Like we know that the functionality reduces. And what we also know is that the amount of endocannabinoid in the body, for example, one of the endocannabinoids, if you're like interested, is anandamide. It's from a Sanskrit name, and the name is bliss molecule. The bliss molecule, when you have it in your body, you feel good, you have less pain, and actually it peaks when a woman is on her ovulation. So all of that like reduced year after year when we go through like perimenopause and menopause transition.
So interesting, thank you. Longevity medicine increasingly focuses on biomarkers rather than symptoms. Do you believe the future of female longevity assessments should include ECS biomarkers such as AEA levels, DHA-derived NAEs, and platelet FAAH activity alongside traditional hormonal measurements?
Yes, but it's still we don't have, we know, for example, for a healthy pregnancy, for like healthy bone, for like against osteoporosis, all of that endocannabinoid system is involved. But because this science is new and the endocannabinoids are kind of hard to measure, we don't have a standardized procedure for that. The closest that we can do is like the measuring our fatty acids, like omega-3 to omega-6, and the ratio of omega-6 to omega-3 fatty acids in Western diet is ridiculously high. It's like around 20:1, which it should be like maximum 4:1. So that is an indicator because the endocannabinoid system and the cannabinoid based on our dietary fat. And so that is something that's the first clue if a system is red or blue.
Thank you so much. And inflammaging has become one of the dominant theories of biological aging. How important is the endocannabinoid system in maintaining inflammatory homeostasis, and what happens when this regulatory network begins to fail?
So I just shortly explain what endocannabinoid system is. So endocannabinoid system, we have like two major receptors, CB1 and CB2. Okay. CB2 receptor is mainly responsible for almost all the immune modulatory processes that happen in the body. And of course, like targeting CB2 receptor, preclinical studies shows that it could be very, very helpful also with osteoporosis, because again, we are talking about longevity, and longevity is not just having a beautiful like skin and beautiful face. Longevity is that you have a strong bone, you have a strong muscle, you are a strong woman inside and outside, and yes.
Many women experience changes in sleep quality, mood, cognitive performance, and stress tolerance during the menopausal transition. Could the endocannabinoid system represent the missing biological link connecting these seemingly unrelated symptoms?
Yes, actually that's what endocannabinoid system does. Endocannabinoid system is like a mycelium network. Maybe I give a shorter story why we know even endocannabinoid system exists. Maybe some of you could have guessed that endocannabinoid system is the terminology is very close to cannabis, because around 35 years ago, scientists started to get a little bit interested. Okay, we know what all of the other drugs like opioids, cocaine, in which receptors in the brain and body they are function. But cannabis was a big question. And after they basically isolated the active compound of cannabis plant, women actually find out that there are receptors in the brain for the cannabis plant, and that was the moment that we start this like beautiful omnipresent mycelium-like network all over our body. And then the question becomes, Obviously, our body doesn't have endocannabinoid receptor because of cannabis. Like, it's evolutionary, doesn't make sense. So what is the role? What we have is what stuff is in the body that interact with the endocannabinoid system. And that's why many women, like perimenopausal women, menopausal women who use cannabinoid-based therapy, they report better sleep, better sexual function, better, less pain, and so on and so forth.
So interesting.
Yes.
Thank you so much. Your work emphasizes the importance of early intervention. Is there a critical biological window during the menopause transition in which supporting the ECS may have the greatest impact on long-term brain health, vitality, as well as resilience?
Yes, so as I said, menopause is not a one day, it's a recalibration phase. And as soon as you think, okay, I am not feeling like myself, that is a legit symptom that you are entering the perimenopause year, and that's nothing wrong with that. Many women, like when I talk to my clients, the first signals is like brain fog. They get forgetful, they have pain, they cannot sleep, and all of that come in clusters, sometimes more, sometimes less, because of all of these up and downs in hormones. So that's exactly the time that you should do something about it, not waiting like too long.
Thank you so much for your expertise. It has been truly a pleasure having this conversation.
Sure.
Please, thank you.
So now we have Dottoressa Fozzi.
And now I'm more than happy and welcome to Dr. Foz to come to the stage. Thank you so much.
Thank you.
Hi again. Now, this scientific session explores the evolution of intimate aesthetic medicine toward a more functional, anatomical, and regenerative approach. Beyond moving the concept of cosmetic correction, the discussion will focus on tissue quality, collagen stimulation, vascularization, anatomical preservation, patient selection, and safety in feminine intimate procedures. Particular attention will be given to how regenerative biostimulation can be integrated into clinical practice through correct indications, anatomical knowledge, individualized protocols, as well as case-based evaluation. The session is designed for physicians interested in a medically rigorous approach to intimate regenerative medicine, combining aesthetic outcomes, functional improvement, and patient-centered care. I'm honored to have you, Dr. Foz.
Honor is mine.
Do you want to tell a little bit about yourself?
As I said already this morning, I'm Dr. Foz. I studied in Rome Sapienza. I'm a dermatologist, and also KOL speaker and international trainer for many companies, but basically focusing on biostimulator.
Excellent. And today, the field is moving beyond purely aesthetic correction toward a more anatomical, functional, as well as regenerative approach focused on the tissue quality, patient safety, and long-term clinical outcomes. This does require physicians to combine precise anatomical knowledge, careful patient selection, ethical communication, as well as evidence-oriented treatment planning. To explore this emerging area of regenerative feminine medicine, I'm so honored to have you. And our first question, Dr. Foz, is that in recent years, intimate aesthetic medicine has moved from purely cosmetic procedures toward regenerative and functional approaches. So tell me, what is driving this clinical evolution?
So, intimate aesthetic, it's been there for a long period of time, but in recent years, as a study done with the Society of the American Plastic Surgery shows, actually 20% increase of the intimate aesthetic surgically and also non-surgically. So that's why it's a new focus and highlighted also in the aesthetic medicine, especially for non-surgical procedures.
Thank you. And when treating the intimate area, anatomical knowledge is essential. Which anatomical structures and tissue layers should physicians always consider before planning a regenerative or biostimulatory procedure?
So basically, as we already know, as medical doctors, anatomy is very essential and important, also in the intimate area, because so many doctors, they believe anatomy of the intimate area and vulva is so simple, which is not true. We also having the arteries and vein, that's very important. So knowing your anatomy for having the best result is very important. But regarding the using biostimulator, especially in intimate area and the other part of the body, also face, the layer of the injection is the most important to know, so you're gonna end up with a good result and actually getting more collagen biostimulation rather than making scars, which we were talking about it all day.
Exactly right. Thank you. And from a biological perspective, Dr. Foz, what is the rationale behind regenerative biostimulation in feminine intimate medicine?
So as Dr. Shabnam already said, there is a direct connection between the estrogen declining and losing collagen, especially collagen type 3